There's a lot of people that don't get the care that they need, whether that's in their childhood or as adults. I mean, I think everybody deserves a chance. Our job is to help reduce recidivism.
Up before they leave the jail so that they at least have a chance when they leave.
If you want to be able to get that jump start instead of just leaving jail and having nothing, they'll set you up. They'll get you the best that they can get you and see where your needs are, what's been getting you incarcerated, and how maybe we can break that cycle.
People that think they have no support, they actually have support, and they just didn't know that they had that.
The biggest thing is I see hope and a will to live come back to them.
It kind of is just a trickle-down effect. If you've got hope, then they get the motivation as they make progress. That further motivates them and encourages them to keep going.
We are getting them and trying to rehabilitate them to be a successful member of society, to one day get a job and be able to work and take care of their own families.
Being there for somebody and helping them is just a great feeling.
So my staff are in 9 different counties. And they work alongside our judges, probation, DA's office, and public defenders.
We are surprisingly close-knit despite the fact that we all work in different counties, and even like my case manager, Rebecca, she's awesome. We don't see each other on the day-to-day, but we all are constantly calling each other and saying, hey, I've got this client, I need help with them on this.
They get referrals from pretty much any source that you can imagine. Family, friends, probation, judge, jail, even medical providers can refer, and our own Frontier Health staff can refer.
Lots of times I might not know any background on this person, and the more I talk to them, the more I engage them, the more that they're going to tell me, and the more I can kind of decipher and assess from our conversations in addition to the assessments we do on paper for the facilities.
Often I say, what are your needs or what are your charges? Because sometimes they don't realize a need that they have, but if you can spot it in the charges that keep bringing them in their history, then it's easy to figure out where to go from there.
We help assist in mental health treatment and alcohol and drug treatment.
You know, just setting them up with some outpatient care. Maybe they just need some, mental health medications because they've been off of their medications while they've been in jail.
We create a treatment plan for them and how they're going to be successful, making sure that we have all of those resources set in place and explaining to the courts, this is the plan, this is how we're going to execute it. The client just has to follow through, and they'll have support to do that.
Before we step in, a lot of them have never had help or know what's out there, but they don't know how to access it.
Wins are when we can get someone set up for services before they even leave the facility that they're in. That is what this program is designed for.
You never know what you're going to come upon, but we try to do our best to link and refer and find those resources that the judges or the attorneys or other folks don't have time to do. We get out and research those things for them.
We stay on top of them and we're there for them. They can call us at any point. We can continue to help them with whatever they need, if they need mental health, if they need physical health, if they need any of those things, we're there for them. And we just try to help them in any way so that they can help themselves.
If there's a will, there's a way, and it's maybe hidden, but we will dig until we find it.
We might get a referral from the jail or probation, and we're able to go and talk to the DAs with the client's permission. We're able to go talk to the DAs and advocate for them and say, hey, there is this treatment option available to them. If it's an option for them, we would like to help make that happen.
And you see that it's not just in the recovery community that people have a heart for trying to get people help, but it's all around. People who work at the jails, they see the inmates for who they are rather than just inmates. And I think it's really great that once you can build that relationship, not just with your clients, but with the jails and the judges and the court systems. I mean, the attorneys, they will come to me and we'll talk about these clients and try and figure out how we can all best help them.
They ask us for anything that we can do. They ask for our help, and it's a really great, it's a collaborative work relationship, really.
You see that light bulb and it's just like, it's an amazing feeling. You see it, they see it, you know that they're really gonna go far and they're gonna get the help that they need and they're gonna go and do something and hopefully cycle out.
By the time they're in jail, they've lost everything. They have no support systems left. They have no money left. They are rock bottom. And watching someone actually come back from that, watching it is amazing.
Seeing somebody turn their life around and seeing what can be instead of what was, there's no way you could duplicate that feeling with any amount of money or anything. It feels good.
Some of my clients now, maybe they've gotten their kid back, or they're, and they're out here and they're living a normal life. They're off drugs and they're being a mom, and they always wanted to do that, and now they can because we've helped them get to the point where they can. They have a full-time job and they're just living a normal life, and that's all they ever wanted.
If I could just help one person, it's worth it. But we've been able to help quite a few people with this program.